myself Srija. Today you are going to learn about the ICD-10-CM coding for the diseases of digestive system. You will be able to know about how the codes are assigned, on what basis they have been assigned, and also the examples for each anatomical parts of the system. So let's first we will discuss about the introduction to ICD-10-CM. So what do you mean by ICD-10-CM? I stands for international, C stands for classification, D stands for diseases, and this 10 it indicates a 10th revision or 10th edition, whereas CM indicates clinical modification. So ICD-10 CM means International Classification of Diseases. It's a 10th revision and for clinical modification. It is a standardized coding system which is used in US healthcare to classify and record the diseases and also the conditions and medical procedures. So who developed the ICD-10-CM? This ICD-10-CM, it was developed by WHO, means it's a World Health Organization, and modified by the United States. ICD-10-CM, it helps ensure uniform documentation, accurate billing, and effective data collection for research and public health. So each code in ICD-10-CM, it represents a specific diagnosis or condition, allowing healthcare providers, hospitals, and insurance companies to communicate consistently. So what is the purpose of ICD-10-CM? Why ICD-10-CM is helpful in the healthcare system? Because it helps to identify the diseases and health conditions accurately, to support medical billing and reimbursement, to analyze healthcare trends and statistics, to improve the patient care and public health reporting. So what is the structure of ICD-10-CM code? These codes are actually alphanumeric and can be 3 to 7 characters long. The first character is always a letter and the following may be numbers or letters. The first 3 characters always denotes the category of the disease, whereas a 4th to 6th character, it indicates the cause, location and severity of the disease. And whereas the 7th character, the last character of the ICD-10 code, it indicates additional information in detail like episode of care. For example, if a patient is diagnosed with acute appendicitis, the ICD-10-CM code is K35.80. This code helps hospitals and insurance companies to record and process the diagnosis correctly. Yeah, and in this topic, it covers the ICD-10-CM coding for the diseases related to the digestive system, and WHO has assigned the code range K00 to K95 for all the conditions which are related to the digestive system. And what conditions, what are involved in this ICD-10-CM coding classification, we will learn about in detail, right? And this is the classification of ICD-10-CM coding ranges in digestive system. K00 to K95, this is the diseases of the digestive system. And K00, K14, this code range, it indicates about the diseases of the oral cavity and also the salivary glands. For example, like dental disorders, oral cavity, it includes mouth, teeth, tongue, etc. Right? So example for this is dental disorders, whereas K20 to K31 code range, it indicates the diseases of esophagus, stomach and duodenum. For example, gastritis and ulcers. Gastritis means inflammation of the stomach. And K35 to K38, diseases of appendix. For example, appendicitis means inflammation of the appendix. And K40 to K46 range codes, this describes the diseases related to the hernia. You know, we have 4 different types of hernia. So all the problems and diseases related to hernia will be classified in the range of K40 to K46. And coming to K50 to K52, these are the non-infective enteritis and colitis. For example, like Crohn's disease and also the ulcerative colitis. Colitis is nothing but the inflammation of the colon, whereas non-infective enteritis means entero. It indicates small intestine, whereas itis, It indicates inflammation. So enteritis is nothing but the inflammation of the small intestine. And next, K55 to K64. These are the other diseases of intestines. What do you mean by other diseases? For example, intestinal obstruction. Obstruction means blockage. So blockage of the pathways of the intestines. K65 to K68. Diseases of peritoneum and retroperitoneum. What do you mean by peritoneum and retroperitoneum? Peritoneum is nothing but it's a thin smooth membrane that lines the inside of the abdominal cavity and it covers most of the abdominal organs, right? It acts like a protective covering and it also helps the organs move smoothly against each other when you breathe or digest the food. Whereas retroperitoneum, retro means behind. The name itself describes the word behind peritoneum, means it's a space behind the peritoneum. There are several organs in retroperitoneum area like kidneys, adrenal glands, pancreas, aorta, and also the inferior vena cava, and also a part of the duodenum and the colon. And next, K70 to K77, disease of liver, and K80 to K87, disease of gallbladder, biliary tract, and pancreas. K90 to K95, other diseases of the digestive system. Now, let's discuss about brief classification of this coding range of digestive system. Yeah. So in this slide, there are diseases of the oral cavity and salivary glands. ICD-10-CM code ranges from K00 to K14. And this section of ICD-10-CM includes all the diseases and disorders that affect the mouth and the salivary glands. The code range K00 to K14 is used internationally for recording, classifying, and billing those conditions. Oral cavity, it includes mouth, teeth, gums, tongue, lips, and inner cheeks, while the salivary glands produce saliva to help with chewing and digestion. This code ranges identifies diseases that affect any of these parts. And this code range, it includes diseases of oral cavity and salivary glands, disorders of tooth development and eruption, embedded and impacted teeth, dental caries, and other diseases of hard tissues of teeth, and also gingivitis and periodontal diseases, cyst of oral region, diseases of salivary glands, stomatitis, and also the related lesions. Let's go into brief description of these codes and with examples. Here, the first code K00. K00, this range of ICD-10-CM, it covers abnormalities in how teeth form are appearing. How teeth form is appearing. For example, anodontia. Anodontia is nothing but missing teeth. How can you define anodontia? It's a complete or partial absence of the teeth. Like it is a rare dental condition where a person is born without some or all the teeth because the teeth never develop. This anodontia can be of two types. What are they? They are complete and partial. What do you mean by complete anodontia? Means no teeth develop at all, neither baby or primary. Whereas partial, one or more teeth nor adult teeth is missing, but not all the teeth are missing. This partial hypodontia is also called as hypodontia. Partial anodontia is also called as hypodontia. These are commonly affects certain teeth such as lateral incisors or the wisdom teeth. You can see here the teeth structure. The upper part crown and the lower part the root of the teeth, the root canal of the teeth. And this is the enamel, dentine, pulp, and these are all the gums. The pink color is called as gum or gingiva and cementum. And you can see here the blood vessels which are red, yellow and blue in color. And this is the lining and which is called as periodontal ligament. And there are also lateral canals present. And this one is the nerve. And next, this K00 0.0, it indicates anodontia. If a patient is diagnosed with anodontia, the isolated NCM code is K00.0. So you have to assign this code for anodontia. And next code is K01. What it determines? Embedded and impacted teeth. So what do you mean by embedded and impacted teeth? These both refer to the teeth that have not come yet, have not come out into their normal position in the mouth. They remain inside the jawbone actually. They remain inside instead of appearing into the dental arch. So they cannot appear like the normal teeth. They will be remain in the jawbone instead of appearing to us. Embedded teeth, this is a tooth that fails to erupt because there is no natural force or path for it to come out. Whereas the impacted teeth means it tries to erupt but cannot. Right? Embedded, it doesn't. It fails to erupt. Whereas impacted, it tries to erupt but it cannot. So embedded, it will never try, but impacted, it tries. But both of them do not erupt and they still remain in the jawbone because something is blocking its path. Its meaning is something is blocking its path not to erupt, right? So most commonly are the impacted teeth like wisdom teeth, the third molars and also the canines. And this range of codes K01 is used when the tooth fails to erupt normally and it is trapped within the bone or gum tissue. So K01.0 embedded teeth. So when a record is assigned for this embedded teeth disease, so K010 should be given as the code, right? So coming to the K02, it's a dental carriers or other diseases of the hard tissues of teeth. Nothing but dental carriers, arrested dental carriers, and this code is classified again into K02.1, K02.2, K02.3, and there are many other codes of related to the hard tissues of teeth. So these other diseases of hard tissues of teeth code range, this includes wear, erosion, and structural problems of the tooth surface which is not caused by decay. For example, arrested dental carriers. So if a patient is assigned with arrested dental carriers, the isolated CM code is K02.3. The meaning is these are responsible from grinding, aging, or acid damage rather than the bacterial infection. So K03, coming to the next code, K03. What is the disease of pulp and periapical tissues? What this covers? This covers the inflammation or infection of the tooth pulp and the surrounding tissue at the root. For example, excessive attrition, that is nothing but a tooth wear, right? We all wear a tooth wear. So that is the tooth wear and its code is K03.0. So if a patient is diagnosed with excessive attrition or the tooth wear, then the isolated CM code is K03.0. And next coming to K04. This code range, it indicates diseases of the pulp and periodontal diseases. So these cover the inflammation of the tooth pulp and surrounding tissue at the root. For example, K04.1. What this code indicates? Necrosis of pulp. So what do you mean by necrosis? So what do you mean by necrosis? Necrosis means death of the dental pulp, which is of pulp, the soft tissue inside a tooth that contains nerves, blood vessels, and connective tissue. When the pulp loses its blood supply, it dies, right? When blood supply is struck away or stopped, what usually happens? The cell dies. So here the blood supply is stopped, so the cells of the pulp dies. That results in the necrosis of the pulp. This makes a tooth non-vital. These codes are used for the root canal related or deep infection conditions. And coming to the next code, K05, what it is? Gingivitis and periodontal diseases. Here you can see a clear picture of tooth, that is here, and this side it indicates the gingivitis and the other side it indicates the periodontitis. In both inflammation, you can see here, you can clearly see the inflammation over here in the picture. So what do you mean by gingivitis and periodontitis? So what's the difference here? You can see in the picture. Gingivitis, it is the inflammation of gums, right? What you are seeing here, the pink colored part is called as gums or also gingiva. So inflammation of the gums is called as gingivitis. This is caused by the plaque buildup on the teeth. You can see a plaque development on the teeth. Whereas periodontitis, it occurs when the gingivitis is left untreated and the infection spreads deeper into the tissues. When gingivitis is left untreated, when this is untreated, when the inflammation of the gums is not treated well, not treated properly, then periodontitis occurs. And this infection, it spreads deeper into the tissues. So what happens when this infection occurs deeper into the tissues? The gums pull away from the teeth, forming the pockets that collect bacteria. The bone and the connective tissues that hold teeth in place begin to break down. So this can lead to the tooth loosening or the tooth loss. So this code range from K05.1 to K05.5 or 6. This includes the inflammation and infection of gums and supporting tissues of the teeth. Here K05.1 code, it indicates chronic gingivitis. For example, if a patient is diagnosed with chronic gingivitis, then the ICD-10-CM code is K05.1, right? And then coming to the K06 code, this indicates the other disorders of the gingiva and edentulous alveolar ridge. What does this code represents? This covers gum tissue disorders that are not related to gingivitis. So gingivitis and different, the diseases other than the gingivitis are included in the code range of K06. You are getting my point, right? So these conditions are affecting the jawbone area where teeth are missing. For example, K06.0, gingival recession. Gingival recession is nothing but a gum pulling away from the mouth. So problems with gum and bone support structure around or after tooth loss is assigned with this code K06 and K06.0. And coming to the next code, K08. This K08, it indicates the disorders of teeth and supporting structures. So this covers tooth loss, looseness, or mechanical problems not due to decay or injury. So K08.1, what it indicates, why this code is assigned? This code is assigned for the diagnosis of loss of teeth due to trauma or disease. So these are mostly the structural or age related conditions of the teeth, right? So when do you lose the teeth? In the over age, after 50 or 60. So these are the mostly structural or related conditions of the teeth and their supporting tissues. For example, loss of teeth due to trauma or disease. So we can lose it teeth because of the other diseases sometimes, and also sometimes due to the trauma. Trauma is a psychological condition. And then next, coming to K09 code, this code indicates cyst of oral region, not elsewhere classified. Not elsewhere classified can also be denoted by NEC. Here it includes fluid filled sacs cyst. Here K09.0 code, it denotes developmental of non-odontogenic cyst. So what do you mean by cyst? It's a fluid filled sacs, right, which can be developed in the jaw, gums, or other oral tissues. Now, what do you mean by odontogenic? Odontogenic means a tooth producing or originating form. Odonto means tooth producing or originating from fluid-filled sac that develops from tooth-forming tissues. Whereas non-odontogenic cyst, it indicates not originating from the tooth. Odontogenic means originating from the tooth, and non-odontogenic, not originating from tooth forming tissues. So when a person or a patient is diagnosed with developmental non-odontogenic cyst, the ICD-10 code is K0.0. This code helps hospitals and insurance companies to record and process the diagnosis correctly. And coming to the next code range, K11, K12, K13, K14. K11, these are the diseases of the salivary glands. So what are the salivary glands? Parotid gland, sublingual gland, submandibular gland. You can see here in the picture. These are the salivary glands, and this covers inflammation, infection, obstruction, and also the enlargement of the salivary glands. For example, sialodenitis. Sialodenitis means sialo. It's a medical term of the salivary gland, right? So itis means inflammation, as I said you earlier. So sialodenitis means inflammation of the salivary gland. Yeah. So next, coming to K12 code, it indicates stomatitis and related lesions, means it includes the inflammation or ulcers inside the mouth. For example, K12.0, recurrent aphthous ulcers, can also be called as canker sores, RAU. These are commonly called as canker sores, which are small painful ulcers that appear inside the mouth. They come back again and again. So that's what the meaning is recurrent, right? So recurrent means coming back again and again. So they come back again and again and usually heal on their own in 1 to 2 weeks. So that's why it was named as recurrent aphthous ulcers. What are the common sites for these ulcers, for these type of ulcers? Inside of lips or cheeks, tongue and soft palate, back part of the mouth, and also the floor of the mouth. And then coming to the next code, K13, it indicates the other diseases of the lip and oral mucosa. For example, K13.0, diseases of lips. So when patient is diagnosed with disease of lips, so this ICD-10 code is K13.0. You must to give this code for the accurate coding, right? So here it covers the disease of the lip, inner cheeks, and lining of the mouth. Any diseases related to the lip and also the inner cheeks and also the lining of the mouth, the upper part lining, the lower part lining, everything is coded over here in the code range of K13. This is mostly used for surface lesions or tissue changes that are not classified elsewhere. Next, coming to K14, here a disease of tongue. So the disease of tongue, every disease related to the tongue anatomy and the tongue part can be coded over here, K14. For example, K14.0, what it is? Glossitis. Glossitis means, here itis means inflammation, whereas glosso. So glosso is a medical term of the tongue. So glossitis means inflammation of the tongue. So this includes the inflammation, ulcers, and movement disorders of the tongue. So these codes cover tongue swelling, pain, or abnormal surface changes. So that's it, guys. This is all about today's session. In the next session, we will be able to learning about ICD-10 code ranges for diseases of esophagus, stomach, duodenum, and all other the parts. So thank you. Have a good day.